All right. So today we'll start CPT, the next section that is surgery, because the NM we completed, and the second section is anesthesia, but we'll take it after the surgery. So we'll start section number three, that is CPT surgery, right? So before we start, coding, the coding part, we have to understand certain things. When you say surgery, surgery is a surgical procedure, is an invasive procedure. Invasive procedure is the sense you have non-invasive, minimally invasive, highly invasive procedures. Just remember, non-invasive procedures, that means like X-rays, CT scans, or ultrasound. These are all non-invasive procedures. Minimally invasive procedures like injections, catheters. These are all minimally invasive procedures where something is introduced into the body. But when we're talking about the surgeries, they are highly invasive. So the surgeon will cut open and do excision, introduction, all those things. Then they close the body area. There are highly invasive procedures. Surgeries, what we call. That's the reason we have surgery section and medical section separately. Surgery section includes highly invasive procedures, of course. Now, surgery is done basically because of a medical reason, right? Valid medical reason. That is surgical disease. If it is a medically treatable disease, they don't do surgeries. So, what are the surgical diseases? This is a list of surgical diseases, routine surgical diseases, like any lump, mass, swelling. Because usually patients they do come with lump or mass swelling. They're all one and the same, and even patient doesn't know what it is. And by examining, by taking history and examination, doctor is able to understand to some extent what type of swelling is it, what type of mass is it. But to confirm the disease, the surgeon has to proceed with investigation, right? Right, like CT, ultrasound, those tests. When you do those tests, CT, MRI, ultrasound, then you'll get to know whether it is an abscess or tumor or a cyst. So that is, they try to treat these conditions with medicines, but if it is not cured, that's when the surgeon puts a knife. That is surgery. Now, second category of surgical is ulcers. Some patients they do have wounds, chronic wounds or ulcers on the body. So yes, they have to treat with some minor or major surgeries like grafts, skin grafts, repairs, debridement. Those are the surgical procedures. Injuries, it can be fractures, dislocations, or lacerations, whatever. It requires sometimes surgery. Some injuries they heal on their own, but most of the injuries they require some procedure. Or deformities, whether it is congenital or acquired. If there is a deformity, to correct the deformity, the surgeon has to do a procedure. So these are the few examples for surgical diseases. Throughout CPT, you're going to find surgeries done for these diseases. Very important. Before you start coding for surgeries, you must look at why surgery is being done. That's important. Now coming to the actual surgical procedures. These are all called root operations. Please make a note. Root operation, or surgical procedures or surgical techniques, what you call. What do you mean by this? Any surgeon, whether a dermatologist or orthopedician or cardiologist, they'll do these basic procedures. The only difference is organ is different. Dermatologist will do procedures same aspiration on skin. Orthopedician will do the same aspiration on muscle, cartilage, ligament, bone, joint. Cardiologist will do the same aspiration on heart, artery, vein. Urologist will do the same thing on kidneys, bladder. That's the only difference. So what I'm trying to say, you must know the list of the surgical procedures, the basics one plus the definition. Very important. So let us go through these techniques. Aspiration. So what is aspiration? Or sometimes known as general term. You Put the fluid with the help of a needle and syringe. For example, there's an abscess or a cyst. What is abscess? We discussed, right? What is abscess? Cavity filled with pus. Cyst is again a cavity filled with clear fluid. That is cyst. So if there is cyst, they do aspiration. They take needle and syringe. They withdraw the fluid. That is aspiration. So we have separate CPT codes for this. Biopsy, taking out a small tissue from any organ. Imaging guidance, very important. Sometimes, if the surgeon wants to take a biopsy, if it is the organ is deep seated, with the naked eye, you cannot put the needle exactly in the same place. So you have to take the assistance of ultrasound, CT, MRI. So in the monitor, that will clearly tell you where is your needle. Is your needle in the liver or somewhere else? That is imaging guidance. Very important. Incision. What is incision? Opening, cutting open, cut open. That is incision. So example, laparotomy. Laparo means abdominal wall. Otomy is the suffix indicating incision or opening. So it is a basic procedure because to do any surgery, first thing you have to do is give an incision, the body surface area. Drainage, taking out the fluid. But what is the difference between aspiration and drainage? In both the cases, it's taking out the fluid, but here you take the fluid with a needle syringe. Here you have to do incision. So that is incision and drainage, what we call IND. This is a very basic procedure. If a patient is visiting with abscess, lump with pus, the first thing what they do is incision and drainage. Then we have the debridement. Debridement. What is it? If it is a chronic wound, what is chronic wound? Non-healing wound. The wound is there for months, 2 months, 3 months. It's not healing. So what do you see there? Dead tissue. So you have to remove the dead tissue. That is called debridement. So how it is done? With the help of scalpel, blade. There's a fine, sharp instrument. So that's how they do debridement. The sparing. So removing of outer covering of skin, the epidermis. There's another procedure called shaving. This sparing and shaving are related to dermatology. Both look alike, but the you have to go by the name. If the surgeon mentions sparing, you have to go by this, or if the surgeon mentions shaving, you have to go by this. Then excision. This is very throughout. This is actually major procedure, excision. Throughout CPD, you have a lot of codes for excisions. Removal of part of the organ. If you take a small tissue, that is called biopsy. But if you take part of the organ, that is called excision. Ectomy. Ectomy is suffix. Appendectomy. Resection. Removal of entire organ. Kidney is totally removed. So under what circumstances they remove entire organ? Any example? What is the surgical disease usually?
Gallbladder removal.
Oh yes, yeah, gallbladder removal. Because totally because when the organ it is totally not usable, right? It is totally dysfunctional. That's when you take the entire organ. It can be cancer or it can be stones, gallbladder stones. It's fully filled with stone. That's when you take out the gallbladder. So yeah, this is destruction. Destruction is if there is abnormality in the body, any organ, if it is destroyed, that is called destruction. But what is destruction? You're using some energy, force, like high temperatures. electrocautery, or low temperatures cryotherapy, lasers. They are the energy sources. If you use those energy sources and remove the lesion, that is called dissection. Whereas excision, you use the blade, knife. That is excision. And introduction. So if you are putting something inside, it can be a drug or it can be catheter, it can be any device. That is introduction. Repair. So if anatomy is altered, for example, if the structure of a body organ is changed because of injury, for example, laceration, you have to restore the body part, right? The way you restore it, that is called repair. Suturing. The simple example is suturing. Plasty. Plasty is this suffix indicating repair. So device. What do you mean by device? Any foreign material, that is put inside, it can be catheter. So whenever when we refer to the device or implant or catheter, whatever, three procedures come into picture. One is removal. So we can add placement. Initial placement, you have separate CPT codes. Whatever that is placed, if you are removing after 1 or 2 months, you have separate codes. Or if you are adjusting the device which is placed earlier, that is called revision. And replacement is you are taking out the old device and putting a new one. That is replacement. So this is initial placement. What you can write. It can be catheter also. Graft, graft, right? This is again replacement. This replacement of the tissue, body tissue. That is graft. Examples: skin graft, CABG, coronary artery bypass graft, where graft is placed inside the body. Reconstruction. This is advanced way of repairing things. Repair, reconstruction. Usually these two words go together. Repair and reconstruction. So reconstruction involves sometimes grafts also. For example, in an accident, somebody, there is a severe injury to the nose, totally disfigured, for example, or ear is totally disfigured. Now you're going to reconstruct it. Plastic surgery. Transplantation, kidney transplantation, liver, then endoscopies. I'm sure you're aware of these endoscopy procedures: upper G endoscopy, colonoscopy, cystoscopy, nasal endoscopy, bronchoscopy. And finally, we are at ostomy and stoma. What is ostomy? Artificial opening. Um, Stoma is also artificial permanent opening. So what happens sometimes, uh, imagine a patient has cancer of esophagus. Cancer of esophagus. Esophagus is essential organ to swallow food, right? Otherwise, food will not reach the stomach. But there is cancer in the esophagus. The food is not going inside. What do you do? They create a hole, opening on the abdomen that leads to stomach. That is ostomy or stoma. So now food is placed inside the stomach through the abdominal wall to the opening. That is called gastrostomy. So these are all artificial openings. Yes, you're going to see the procedures like this.
So,
So
what is the
your
example of stoma?
stoma is again, this is permanent. Ostomy, when you say ostomy, this is also artificial opening, but this is a surgery basically. There's a procedure. Ostomy is creating opening, but stoma is the opening which is there permanently, artificial opening. Both are interrelated. This refers to the procedure, the technique, the surgery itself, but this refers to the opening. You call that, for example, a patient has that opening on the stomach, on the abdomen. You call that stoma. It's like now. This is the procedure name. This is the name given for the opening, stoma. All right. So please go through this document. I have given detailed description or definition for each and every procedure again with some examples. Um, yes, and we'll go over these topics also. All right. So let us go to the CPT surgery section. So ENM all 99,000 series, right? The code start with 99. CPT surgery section code starts with 10,000 series. 10,000, 20,000, 30,000, 40,000, 50, 60,000. So what you call 10,000 to 60,000 series codes are under surgery, basically. So the first subsection is integument system, skin. All right. So, and before we start, we have certain CPT basic concepts that we need to review. Some we already reviewed, the general concepts, but now today we'll go through the global package and global period. So we partly discussed about this global package and global period, but this is very specific for surgery. It's very important. So go through this global package, global period. What is global package? What is the global period that includes? The surgical package, what you call surgical package, includes three phases: pre-operative, intraoperative, and post-operative care. The surgeon has to take care of the patient before surgery and during the surgery and after the surgery. For how long, that will be decided by global period. For major surgeries, it is 90 days. It starts one day before the surgery. The global period begins one day before the surgery and ends at 90th day. For minor surgeries, it is 10 days. The global period starts on the same day of surgery and ends on 10th day. So there are some office-based procedures, so for which there is no global period. It is 0 days. The moment the procedure is completed, yes, the period is over. So this is global period.
So, day before surgery,
Yeah, one day before the surgery, that is major surgeries. So what do you mean by this? Any ENM service cannot be billed separately during the global period because the surgeon has to examine, take the history, examine the patient. A decision has to be taken, right, for the surgery. That's the reason everything is included in the surgical procedure, the CPT code. So no ENM code will be billed during this global period separately. Appendectomy is done. The global period is 90 days, almost 3 months, right? After surgery, it is 3 months. During these 3 months, the patient may come for 10 times free of charge. You cannot bill E&M service by the surgeon. That is insurance rule, if appropriate. Alright. So what we do basically, um, so with this basic understanding, we'll proceed to integrate system when we meet on, Monday. But until then, please solve whatever that is pending in E&M, as well as the ICT. So you have in LMS we have a lot of questions over here. Spend whatever time that is possible. Then we'll start freshly the surgery of integument system.